Welcome to today's lecture. Today we will be studying about the sensory innervation of the dorsum of the foot. The sensory innervation to the dorsum of foot is provided by the following nerves. First is deep peroneal nerve, second is superficial peroneal nerve, third is saphenous nerve, fourth is sural nerve. If also the nail beds are included, then we have the medial plantar nerve as well as the lateral plantar nerve. So if you see this dorsum of the foot and you can see these nerves which is supplying it. So here you're having the superficial peroneal nerve. This is the deep peroneal nerve. Then this is the saphenous nerve. This is the sural nerve. Then also here behind the nail beds you are having the medial and lateral plantar nerves. So if you see the superficial peroneal nerve, so most of the dorsum of the foot is supplied by the superficial peroneal nerve. So just above the ankle, the nerve divides into medial branch as well as the lateral branch. So the medial division, they again subdivide into branches which supplied the medial side of the great toe. So this is a great toe. The medial side of the great toe is supplied by this subdivision from the medial branch. The adjacent side of the second as well as the third toe is also supplied by the subdivision from the medial branch. The lateral branch again subdivides into branches to supply the cleft between the third and the fourth toes as well as the fourth and the fifth toes. So if you see the deep peroneal nerve, it supplies the cleft between the great toe and the second toe. This is called the first interdigital cleft. The sural nerve, it supplies the lateral margin of the dorsum of the foot including the little toe, that is the lateral margin of the little toe. Whereas the saphenous nerve, it supplies the medial margin of the dorsum up to the head of the first metatarsal bone. So below this, it is supplied by the superficial peroneal nerve. So the medial plantar nerve supplies the nail beds of the medial 3½ toes, whereas the lateral plantar nerve supplies the nail bed of the lateral 1½ toes. So in this picture, colorful diagram, you can see the regions which is supplied by these cutaneous nerves. So the superficial fibular nerve, which is shown in this brown color, so the superficial peroneal nerve is supplying most of the dorsum of the foot. So here you can see the deep peroneal nerve which is supplying the first interdigital cleft between the great toe and the second toe. Whereas the lateral border of the foot supplied by sural nerve, medial border is by the saphenous nerve. So if you see these toes, the first 3½ the nail bed is being supplied by the medial plantar nerve, whereas 1½ toe, the nail bed is supplied by the lateral plantar nerve. If there is any paralysis of any of these nerves or if there is any injury, the corresponding regions where it supply the sensation around that area would be lost. Thank you for watching.